Hello, I'm Josh Dufresne, the Chief of Practice Operations for Springfield Medical Care Systems, and today I'm honored to be here with Linda Thomson. She is going to talk to us a little bit about clinical hypnosis and want to know a little bit more about clinical hypnosis and who actually Dr. Linda Thomson is.
Thanks, Josh. I am a nurse practitioner, and I have been in practice for over 40 years, more than 25 of those through Springfield Medical Care System. And I was 20 years in practice before I began to use clinical hypnosis in my practice, because up until then I thought it was sort of a little woo-woo out there kind of thing, and then I discovered its therapeutic benefits. It is a very old healing modality that is very much misunderstood and unfortunately therefore underutilized. But we're trying to change that at Springfield Hospital.
You know, we go back a bit, and we've had this conversation before, and almost feeling as though clinical hypnosis is a secret, you know, and we have many different secrets within our organization, it seems like, that people don't know about, and we wish they did. What are some of the common uses for hypnotherapy that people can benefit from?
Well, typically the ones that the public knows about the most is smoking cessation and weight reduction. But it is so much more powerful than that and has so many more uses. One of my very favorite uses is for surgical patients, to prepare them for surgery, to reduce their anxiety, and following surgery to decrease their pain and enhance their healing. It's not in place of anesthesia, it's in addition to it. It can be used also for many habit disorders besides smoking and overeating. Trichotillomania, where people pull out their hair, thumb sucking, nail biting for children, enuresis in children. It can also be used to decrease anxiety, fears, phobias. Hypnosis taps into the imagination, and people with fears and phobias have wonderful imaginations. They imagine that something terrible is going to happen. So it helps them tap into what they're already good at and just take it in a more beneficial direction. It is also wonderful for pain and reducing pain, giving people strategies to help them better manage chronic pain conditions as well as acute pain.
It's interesting because there's so many options out there for folks, and you know, just if we looked at the smoking cessations piece of it, people who have tried counseling, they've tried the gum, they've tried replacing that addiction with exercise addiction or things like that. So hypnotherapy is one of those pieces that's out there that sometimes isn't commonly referred to. I mean, it's one of those that people may not necessarily know about, and I think part of that is just the fact that we don't see a lot of hypnotherapy in our area, professional hypnotherapy, and so we're very blessed to have you within our system to do that. And it sounds like that's just the tip of the iceberg as far as needs and services that you can provide with hypnotherapy. Mm-hmm. How long has this been around? Is this something that's relatively new to medicine, or is this something that's pretty old school?
Well, if you think of hypnosis as the ability to focus attention and inner absorption and go in and harness those inner resources, it has been around for millennia. You know, shamans, mystics, Egypt had sleep temples where people came for healing suggestions. The Greeks had them. So using the power of the mind to heal was there before we had medications and things, but then we had drugs. So, you know, hypnosis sort of got pushed to the background. But the problem with drugs are there's side effects, there's cost. With hypnosis, the side effect is self-esteem, self-efficacy, just all good stuff.
Now, I've seen hypnosis, I've seen hypnotherapy, but the hypnosis that I think most people see is stage hypnosis, and there's this common fear maybe, or this thread that I've seen hypnotherapy, or I've seen hypnosis on TV, and what if I say my innermost secrets and then it's out in public, or whatever it might be, or this stage hypnosis of what if I all of a sudden start walking across the stage barking like a dog. How is this different than what that is?
Unfortunately, stage hypnotists and Hollywood have given hypnosis a very bad rap and have continued with the myths and misperceptions about this healing modality. Stage hypnotists ask for volunteers from the audience, and they don't get the person who's sitting back there like this. They get the one who's jumping out of their seats. They wanted to come up on stage, and they wanted to do dumb things. They never get just one person, they get a whole group up on stage.
Sure.
Then they put them in a hypnotic trance, and in hypnosis you become much more suggestible. So they start giving suggestions like, perhaps you notice how cold it is up here. Yeah. And then they pay attention to who's sitting there looking cold, and if you're not looking very cold, they say, thank you, you can go back to your seat. So they're giving the people who are still on stage the subtle suggestion, if they want to stay there, they'll follow directions. And then they make some other suggestions, oh, it's hot in here. And then, so they end up with a few people up on stage who wanted to be there, who wanted to do dumb things, and are highly hypnotizable. And consequently, people have that belief about hypnosis, that you're giving up control to someone else and that you'll do dumb things or you'll talk and reveal inner secrets. And actually, it's a state of extreme self-control.
So that's why some people can't do that.
Hypnosis is not something that's done to you, it's something you allow to happen.
So if you're completely not open to it or fearful of it, you're going to have more difficulties becoming in a hypnosis state.
And you have to come with the motivation to change.
Mm-hmm.
If someone who's a smoker comes to me because their wife wanted them to, and they don't really want to change,
not going to work.
Nothing's going to happen, because hypnosis cannot make you do anything. It can make quitting smoking easier. It can make stopping thumb sucking easier. It can give you a handle on managing anxiety. If you're motivated, you have the expectation that this is going to help, and if we've established some kind of therapeutic alliance, rapport, or relationship.
I have a friend that took advantage of the service, and he was fearful of flying. And so one of the questions that I had in my head when we were talking about it, because he really wanted to take a vacation and never really had that opportunity to get on a plane without really being nervous. And does this ever wear off? Is there a long-term effect? Can you be mid-flight in a sense, and then all of a sudden, oh my gosh, I forgot about how terrifying this is? Or is it long life-lasting?
Well, when I work with people, I like to give them the skills so that they have what they need, and we often make recordings, but I don't want my voice in their ears as much as I want their skills in their head, so that they can tap into those in the middle of a flight.
Right.
Very often people start to get a little panicky, and then they remember, oh yeah, I can do this to help myself.
Interesting. These services that are provided, where do these happen? Do these happen in our system at home? How does it work, or does it continue to happen beyond your visits? Very much like we talked about lifestyle medicine not too long ago, and you spend some time with our physician there, and then you do a lot of activities in between visits. And how does that work?
I always send my patients home with homework, and that's to practice the skills that they learn in my office. Very often we record the session, and I consider the recording sort of like training wheels on a bicycle. When you first learned to ride your bike, it was nice to have those training wheels there, but then if you really wanted to take off, you had to ditch the training wheels. And it's the same thing with the recordings. I want them to have the skills, not depend on my voice in their ears. So that takes practice. Just like with anxiety, to practice imagining. Hypnosis taps into imagination, imagining those situations. When willpower and imagination are in conflict, imagination always wins. In other words, you can will yourself to get in the car and drive somewhere without the cigarette. But if you can't imagine yourself doing it, willpower alone is going to be tough. So part of what people do in hypnosis is to imagine themselves successful in the future with whatever their goals are.
It's interesting that you speak of anxiety. When we look at our general population and we look at diagnoses kind of as a panel management, anxiety is one of the highest. A lot of people suffer from that, so much so that we have patients present to the emergency department who think they're having a heart attack when it's actually a panic attack, which is a lot of anxiety-based fears. So that idea of having a solution out there, possibly through hypnosis, is amazing. That could really give somebody their life back, which is just amazing for sure.
Yeah, it really gives them the tools to help themselves.
That's great. So where can somebody come and access these services at Springfield now?
Well, there are 6 different providers at Springfield who have been trained in hypnosis, some through the behavioral health program and some also at the Wyndham Center.
Very cool. And is it covered by insurance?
Well, if you were to call your insurance company and say, do you pay for hypnosis? Probably 95% would say, no, we don't pay for that. So the billing is done differently. Those in behavioral health who do hypnosis, it's just part of the therapy they do. They don't bill separately for CBT or DBT. It's just part of their therapy. For me, as a nurse practitioner, I bill it under whatever the diagnosis is, COPD from tobacco or enuresis, habit disorder, that kind of thing, and document the amount of time I spend with the patient, and it's charged as a counseling code.
I see. Now, I have primary care in our system. Would I have to go see my primary care physician first before I come and see you and see if that's a fit? How does that go about?
It really depends on your insurance. Some insurance companies you can choose to come and you don't need a referral. Other insurance companies require a referral that you would have to get through your primary care provider.
Now, I'm going to put Linda on the spot for a moment because we have had these conversations before, but also we are so grateful to have Linda in our system. Linda travels the entire world teaching hypnotherapy. It's pretty amazing that Springfield Medical Care Systems has somebody of her capabilities and her stature in our system. So I want to thank you so much for giving us time, and I want to thank you for being part of our system and really helping a lot of patients.
I love what I do.
Absolutely.